Hi, Voices of the Bench community. I'm Laura Prosser, the Digital Marketing Manager here for Ivoclar North America, and I would like to invite you to start following us on Instagram. It's your chance to obtain exclusive updates on product announcements, industry news, upcoming educational events, and heartwarming stories about our local team and industry professionals. So let's get social together. Simply start following us on Instagram at ivoclar.na. That's Instagram at ivoclar.na. We'll see you there.
Welcome to Voices from the Bench, a dental laboratory podcast. Send us an email at info@voicesfromthebench.com and follow us on Facebook and Instagram. Greetings and welcome to episode 374 of Voices from the Bench. My name is not Grandpa Elvis.
Aw, my name's Grandma Barbara.
Yes, you are. Congratulations, the baby made it.
Thank you. Yeah, it was a 30-hour labor.
Whew. I haven't done anything for 30 hours.
All night longer for this lady. They finally made the decision to have a C-section at 5 after pondering it for 5 hours. And it was a little bit of a cluster, but he's beautiful.
Who ponders it, the doctors or the mother?
The nurses and then the doctor. And yeah, so there was no complications per se. Kept trying to force it, and then finally they called it and said, nope, we're doing a C-section. But he's beautiful. They're both healthy. All is good in my world. How about you?
Awesome. I'm doing all right. I'm doing all right. No new children, which is good in my life. No new dogs, which are basically my children.
Yes, they are.
All is good.
All right.
All is good. Weather's getting running worthy and loving all cold. That. Yeah.
Oh. All right.
You got to give me a peacock update. Last week, you had a killer peacock in your yard. Is it still hanging around?
My neighbor, she's kind of a freak and found a way to get rid of it. I don't know how.
And you're not asking questions.
And I haven't heard it and I haven't seen it. So I don't think she killed it. I think she called somebody to come get it because she said they're nasty and they peck on cars. And
Yep.
So I haven't seen him, but I didn't do anything to him. I enjoyed him, but yeah, he's gone.
Keep your hands clean and
yes,
your
sir.
Head down, and nobody will know.
All right.
Speaking of Florida,
yeah.
segue. Just 3 weeks away from the FDLA meeting. What a better way to celebrate the summer than fun in Orlando, learning about teeth.
Right.
Join me and hopefully Barb. What do you get back Saturday and you're going to try to swing by?
I think so. I might fly into Orlando. It's just, I still haven't even, you know how I roll. I haven't even made my flights yet, so.
No, you do it the day before.
It's way too early.
Well, definitely me and maybe Barb will be at the Jensen Dental booth on June 13th and the 14th. Recording anybody willing to sit down. So make sure you head over to FDLA.net for more information and to register.
All right.
So this week, we get to have a conversation with a dentist in Aspen, Colorado, who's doing some cool treatment planning with a mathematical equation.
No doubt. Super cool.
It's really neat. So Dr. Andrew Turchin knew he wanted to be a dentist the minute he shadowed one. After spending 13 years in upscale part of New York, he moved his practice to upper scale Aspen, doing a lot of very high-end crown and bridge. He developed a pretty simple way to communicate to his lab by using a formula that will dial in both aesthetics and occlusion. Now Dr. Turchin is teaching other clinicians and a couple dental technicians his new way of doing things simply with the end in mind. He talks about having an in-office technician, how the formula works, and how a balanced occlusion goes beyond just the teeth. So join us as we chat with Andrew Turchin. Voices from the Bench. The interview. Barb and I are always super excited when we get a dentist on the podcast. Dr. Turchin, am I saying that correctly?
Yes.
So Dr.
Correct.
Andrew Turchin, you reached out to me and say, hey, are you guys interested in having a dentist on that's got a lab? Yes, I would. How are you, sir?
Very good, thank you.
So you tell me you come from Aspen, Colorado. So
Yeah.
you must do some pretty high-end, expensive dental work, I only imagine. Never been there, but I hear about it.
Yeah, I sure do. I was in New York City for 13 years before I moved here, about
Oh,
13 years ago. It was very similar market for me.
yeah.
And I always took the cosmetic reconstructive route. And here we are in Aspen, Colorado, continuing what we did in New York. And, we've grown it to an education component. We teach a lot of dentists, occlusion and cosmetics and
Hmm.
reconstructive dentistry. And it's a lot of fun. So,
Yeah. Yep. So we usually ask technicians how they learn about dental labs, and it's, no different wanting to know how you learned about dentistry.
Yeah, it was a good friend of mine in college. I was a little bit lost on what I wanted to do. I love sciences and health, so I was thinking about physical therapy or chiropractic, and
Oh, you want to crack some bones, huh? Yeah.
yeah, that'd be fun, right?
Snap a neck or two. Got it.
Exactly. And I just knew I wanted to help people and work with my hands, I guess. And she said, why don't you do an internship with my father, who was a dentist, a friend of mine in
Mm-hmm.
dental school. And it was only about 20 minutes down the road from college. And I did it. And I said, wow, this could be a fun profession. It's tinkering, it's fixing, and it's helping people. It seems like the perfect combination for me.
And just from that, you decided to enroll in dental
That was
school?
it. I applied to dental school right after that, and was lucky enough to get into a couple of schools and chose what's now called Rutgers Dental. I was at Rutgers undergrad at the time, so I guess I'm a Jersey boy at heart.
You always hear about trying to get into dental school being hard, but you just said you got accepted into a couple different schools.
Yeah, I mean, it was a lot easier 26 years ago, 27
Oh.
or yeah, it was
Well,
it
you
was a
sound
lot
young.
easier. Yeah, it's not on video, but you'd see my white beard. I'm 51, so I'd say I'm middle aged now. They tell me. It's one of the reasons I moved to Aspen. It's literally a fountain of youth here. 70-plus-year-olds are skiing double black diamonds on a regular basis. So it's a special, special place.
And how many of them have broken bones?
Oh, they heal. It's the question is how many have replaced parts, knees, hips, almost all of them. And that's the great thing. We have the technology today to replace our body parts, not just our teeth.
That's true. So when you got into school without having that passion for dentistry, was it hard to get into it? Did you find the schooling difficult?
Well, I like the lab aspect.
Yeah.
And then the science is fine. I mean, I did fine. I was a science, major in undergrad. I was an
Mm-hmm.
exercise physiology major. So I don't want to say it was easy. It was very, very hard. It was very intense. The lab stuff was pretty cool. I liked working with my hands and doing things. So I liked that. And then once I started working on patients is I think when I started taking it very seriously. I don't know. I
Mm.
think that's what I was meant to do is help people, heal people. And it's a blast doing it. So that's when I became very passionate. I wasn't acing dental school by any means, but I was scraping by. I'll never forget when the dean called me into dental school and he said, Andrew, you've got some C's and some B's and, you're not doing that great. And I said, that's the same as I did in college. And you let me in with that. That's just who I am,
You know
right?
where you're getting.
Yeah. I mean, I think I'm doing great because in dental school, you take about 50 credits at a time versus college 15. So, or
Mm.
7. And so it's much more intense. So for me to even be keeping up I was just happy I was passing, but I was really proud. I wasn't acing school. I wasn't top of my class or anything like that. But by the time we got to clinics and by the time we graduated, the top people in my class were coming to me as a young, as a new dentist in New York City.
Yeah.
They needed that single anterior tooth. They came to me. They thought I could pull it off. We all know that just takes an amazing lab to pull off
Yep.
and really hard. So, I think clinically is where I shine. I'm not saying I've got the best hands in the world or any of that. It's just I care about the end results for people. So it helps me do my best.
Yeah. When you were going through school and you started seeing those initial patients, bedside, chairside manner, is that even taught or did you have to kind of learn it?
Yeah, I don't think it's taught at all. At
Yeah.
all. I think it's just something you have or learn. And when I say have, we all get better in time, but some people are
Yeah.
more
A little bit more
natural
natural.
at
Sure.
socialization and things like that. And certainly in dental school, it runs the gamut, just as I'm sure it does in the lab industry, right? Well,
Oh
I
yeah.
don't I don't
Yep.
have to guess. I've met a lot of lab technicians over the years. So, and
Yep.
I just got back from Chicago because I
Yeah.
think lab techs are a lot more fun than dentists. That's why I go.
Ah,
So you hung out at Lab Day the whole weekend.
Oh, well, I only was there Thursday night and Friday night and into Saturday I grabbed I think I had a 3:30 flight out. So I had a friend coming to town that it was a last minute decision to go. What happened was I was sitting here seeing patients and I was getting texts from all over the country saying, "Hey, are you going to be there? Love to catch up." And I said, "You know what? Cancel my last patient." I jumped
good
on a
for
4:30
you.
and I went because I always wanted. I went a couple of years before, and it's really it's something I don't want to miss. I really need to go every year. I find it more interesting than going to the dental meetings.
So tell me, as a dentist, like take me through your lab day experience. Do you actually physically go to LMT, and what kind of courses do you look at and go to?
I'm most interested in ceramics courses.
Yeah.
So I mean, I saw a kite, and I
Oh
saw
yeah.
Mm.
Jonathan Burke, and I saw a few different people I knew, and I didn't take as many courses as I wanted to. Number one, because I didn't sign up for any because I didn't plan it.
The
Right? I
last
just
minute.
Yeah.
and then when I got there, it was like go go go, and I hadn't. It's much easier to choose your courses online. That's my
Yeah.
advice. That it hasn't been, but I also wanted to go see a bunch of vendors. I was looking for a new mill, the elusive Emax mill that's can nail it every time.
Oh yeah.
Mhm.
Much harder to do than milling zirconia.
Yeah.
My favorite articulator 82, I had to go see Dave, and I don't know, I just have to go see people and look at the latest technologies. And we're expanding the lab, so there's some equipment that we were looking at, another mill like I said, and maybe some new printers to just expand. We're taking 1,000 square feet adjacent to my office,
Wow.
just for the lab, instead of trying to squeeze, how dental practice try to squeeze their lab into a small space. But
Mhm.
I hope with 1,000 square feet we'll have
Heck
plenty of,
yeah.
right?
Enough
But as
room
I
for a
saw it out,
PN7. Yep.
yeah, right. That's one of those great Emax mills for sure. Obviously, right? Because
Yes.
Ivoclar makes it.
1,000 square feet's good now.
Yeah.
Yeah, right.
It won't be soon.
Yeah, I think about that on occasion, but hopefully enough room for 2 or 3 techs with and a lot of equipment.
Do you have a bunch of partners, or is that just you?
That's just me. I'm
Wow.
one dentist lab. Oh, so why am I expanding the lab to multiple techs and such? I think is what you're
Yeah.
getting at.
Yeah.
Because of my teaching, I have well over, we're probably going to be multiple hundreds soon of dentists we've trained that are always looking for labs that understand our philosophy and
Yep.
can give them what they're looking for. It's sometimes it's lost in translation because we do things a little bit uniquely and tooth form and tooth shape, and what they're really looking for. They come to my course because it's the most comprehensive 4-day course on cosmetics and occlusion there is. And I
Yeah.
know that sounds impossible to teach in 4 days, and I get it. But we've got some tricks of like analyzing cases. We've got a mathematical formula, for instance, that tells us a lot of things that we have to do, and it helps people take years of knowledge and condense it into one mathematical formula. So for all these reasons, my students are, when they want to get going, and they want somebody that understands our process.
Hmm.
So I'd like to support them. And it's always been
Yeah.
hard because we haven't had the capacity. I keep my technicians relatively busy
Yeah.
So you want to build a lab to do outside work then?
as well. Yeah.
Yeah.
The number one thing will always be to support me and my patients
Of course.
first. But
Yeah.
I'm just one dentist, but we do a lot of full mouth reconstructions and, cosmetic reconstructions and occlusal reconstructions, if you will.
So what came first? You doing your own lab work or you teaching?
That's a great question. By the way, I've never done my own lab work. That's silly. I've done some lab work.
Sure.
I know how to do some lab work. I've never been one of those dentists that buy a CEREC and think I'm going to replace my laboratory.
And sit down and want a glaze. Yeah.
Yeah. And I do love it. And I
Yeah.
do it on occasion. Somebody's on vacation, or, we've been in between technicians on occasion, and I've sat down and I've done the work. So I always look at it as a great learning experience, even if it's hard to see patients all day and then work at night trying to finish a 10-unit case. But it's important that I actually know how to do it. But in the beginning, I had never done that. I wanted great work, and I hired a ceramist and a technician, a full, like, old school analog technician that could do everything. Mm-hmm. And I did it because I wanted the best for my patients.
Yeah. Is this in New York?
No, this was here. It was only about 8 or 9 years ago. About 3 years in here, I realized we had a couple of issues. Number one, shipping wasn't super reliable into Aspen.
Yeah. Interesting.
Because of what? Snow and whatever?
Yeah. All that. Exactly. And then number two, I know everybody says, well, there's great ceramists you could just send to. And I've worked with plenty of them, and things could get lost in translation. To me, the most important thing is communication. And we have better tools than ever, photography and, ExoCAD and things to communicate with.
Yeah.
But I tell you, things get lost every day if you want all the details to be right.
Yep.
Yeah, there's no way you can communicate everything. I mean, you can document, you can written word, but you lose a lot when you just don't have the patient there. Are there even labs in Aspen? I don't even know. I imagine there is.
No, it's a tiny town of 8,000 people. So yeah, we're the only lab, but I don't do work for anybody else in town. It's for myself, and every once in a while I have room for another case from one of my students or my buddy.
So how'd you find this magical technician that can do it all?
I called a colleague from New York City, a prosthodontist that always had great technicians in his office. In New York City, it was a thing. I was brought up like that's every practice I worked at before my own. There was a technician. And then when I went out on my own in New York City, we tried to maybe get a technician or have enough space, but realistically it was fine. In my building on Madison Avenue, there was probably 10 technicians in the building.
You're kidding me. I know where Madison Avenue is. That's crazy.
All in other dental offices, right?
There were 2 standalone labs and one lab within a dental office that they were happy to take other cases in.
Wow.
And
all in the same building.
All in the same building. 25 floors of offices, and there was a couple lab. But if I liked a different technician, it was like, okay, he's 10 blocks away. He'll stop by and see a patient. And so it always felt like I had an in-lab technician, and I was used to sitting down with technicians and looking at line angles. I mean, I did this even with Jason Kim. We looked at cases closely together.
Yep.
I don't know. I was so used to it. I spent so much time in the laboratory, the in-house laboratory, as an associate at my first job with Jonathan Levine on Fifth Avenue. And I would wax cases. And I don't know. I just think it's important to get your hands dirty and to touch and feel cases yourself. And that's one of the issues with digital. Even when we're designing digital here in the office, every once in a while, I'm like, just print a model. Let's see if it's really what we think it is.
Because you have to hold it.
See it, yeah. I don't know. Do you guys do a lot of digital stuff? And what's your...
Oh, yeah.
Tons.
I like when I do like a 10-unit veneer case, and then doctor will prep maybe a molar, and I get to print it and look at my work and see the anatomy and everything. And so it gives it a different perspective when you can actually hold the finished product in your mouth or in your hand that's printed in your mouth.
Absolutely.
So
I agree.
I totally get it. So how do you collaborate with your ceramist now? Does he go in and meet the patient with you? Do you?
I don't think we found out how you got this guy yet, did we?
Sorry.
Oh yeah.
Go ahead.
Oh yeah. So it was a normal thing
before the horse.
Yeah.
It's all good.
Well, called one of my buddies. He always said, "I'll find you a technician." So I called him one day. I said, "I'd like a technician. I think a case didn't come in time, or it was mistakenly made the wrong shade.
Sure.
And something happened that I said, that's it. I need my own technician. I do enough of these cases, and I think it'll be a boon to my practice and elevate my practice to have an in-house technician, and a boon to the quality of care I give my patients. It's the number one thing for me."
Yep.
And so I called somebody in New York City, and he said, Andrew, I think I have somebody for you. It was one of the technicians that had moved back to Italy, and he wanted to come back. So, he came to visit. He never left. he sent for his family. They moved later, and that
Wow.
was the first of, it's been about 8 years. We've had a few different people, and sometimes the team is one person, sometimes the team is two people, and the second person is when we decided for capacity issues and everything else. One person's hard to get it all done, to be honest, but a
Yeah.
digital person and an analog person really, really helps the situation.
Mm.
I know you did this for quality of care for your patients, but
Mm-hmm.
honestly, are you saving any money doing this? Is it
No,
costing you
no.
more?
Hell
Yeah,
no, right?
it costs me so much more,
Yeah.
especially where I am.
Oh, the cost
And
of living is insane, isn't it?
exactly. So to house somebody, what I end up giving people housing, giving people their home.
Oh, are you higher? No, I'm just kidding.
Yeah, and I eat that cost, and I still pay them as much as anybody else pays.
Wow.
I figure the cost of living is expensive here. Let me take care of the number one cost of living thing is housing. So housing's taken care of, and then I pay them a salary that's as good as anywhere else, which is just a huge benefit. And this way, they feel comfortable living in a place where groceries are 7% more than nationally or whatever it is.
Mm.
And then how do you guys collaborate together? So you've given them
Oh,
all of that. I'll go back to my other question. Like, do you bring them in to meet the patients? Do you guys do the digital designs? They set them up for you, and then you say yay or nay or change this, or how does that relationship work?
I mean, a little of everything. Even this new edition, they're going to be another 20 feet down the hall. It feels like we're going to be disconnected more. I'm a little worried about that. They are, I don't know, 10 feet from about 10 feet from my main operatory, the Ceramis now.
Wow.
And it's just so close. So whatever we think that they need to be in, if it's about a complex shade, they're in. Usually I have them in for even if we're doing a 20 unit veneer case, we talk about the shade. I think patients, it's a nice, I hate to say it, I learned it a long time ago in New York City. It's a nice show for the patients as well.
Yeah. Yep. Here's your ceramist. Yep.
Yes, exactly. So every part of it, from taking the shade to design, I think the more eyes, the better. So myself, the digital technician designing, and the ceramist are all looking at the case together on a big screen, all giving comments. And sometimes we do the last final touches live together before we go to billing.
Wow.
And I mean, can you imagine the quality of care that you could get with this type of collaboration? I think 4 eyes are better than 2, 6 eyes are better than, I guess there's a number where it's not good, but I think these 3 people, the dentist, the digital technician, and the ceramist, those are great to get together.
Yeah.
Yeah. So they collaborate with that. And then I get to see the case in production. So in other words, before we go, like I get to check it in BizBake, just like
Yeah.
Dennis used,
Yep.
right?
I love that.
And I could say, you know what I see? And I could see a line angle that isn't where, let's say, I think it should be. But I'm not dogmatic. I'm a collaborator. I enjoy us all getting together and all seeing what we see and seeing. And so we'll have a debate. We'll say, well, I don't think that should change like that. So we'll pull out, we have a box of models of real natural teeth that we've taken on our patients, and we'll look at anatomy together. We all learn every day, because I think most dentists and most ceramists, especially, I mean, ceramist technicians, but most technicians, especially because dentists, a lot of them don't really have a clear cut like tooth form in their head.
Right.
But we all have different ones, don't we? Right. Like I like this line angle. I always have it in my cases, and other people don't. I like this rounded distal. Other people don't. And in the end, the patient decides. So the best way to collaborate in my mind is design a case together, put it in the mouth as temporaries, fine tune it till the patient loves it. That's part of the process I teach, and give them a scan of that to work with. It doesn't mean it's perfect, but it's pretty close. In other words, we know the tooth form they're looking for, right? Whether it's a very square look or rounded look or, all of that tapered. And we know the arch form, we know incisal edge position. All those things don't have to guess. And I think a ceramist, the whole idea is that it gives everybody confidence, the ceramist, the patient, and myself, that we're going to deliver a case that meets the patient's desires.
Yeah, it's like a blueprint to a house. Everything's up front. There's no guesswork. Sure, there's some tweaking here and there and some incisal translucencies and halos and all of that. But the end result is that going in, you almost know they're going to be happy, or you pretty much know they're going to be happy with it.
I know. It's like We're at 99%.
Yep.
If a patient doesn't say they love their temporaries, they have to say they love them. If they don't love them, we're not going to go forward. And you said it was a blueprint. You're right. We call it the dual blueprint method. The first blueprint being the wax up, the second
Yep.
blueprint being
Yep.
the temps refined in the mouth to the patient's liking.
So who do you blame at that 1% if you don't have a lab to blame?
I knew that was coming.
Obviously the technician. I kid. It's they say the head of the fish stinks and all that stuff. So the buck stops here is probably more appropriate. In the end, it's my problem, and I have to figure out where we went wrong. It's really hard for us to go wrong, to be honest, with our process, the way we do it.
Mm-hmm.
Somebody didn't do their job, and in the end, it's for me. Labs have the quality control person. In our lab, I'm the quality control person.
Yeah.
I said, sure, looks good, guys. And I went to put it in the mouth. I should have caught the errors beforehand, and I should have. And again, it's very rare, but because we look at it from every angle to see if we're meeting the expectations of the patient.
Have you ever had a patient where they were impossible to please and you just have to call it and just be like, forget it?
There was one that very early in the process, I made her a set of temps, and it was a very difficult case, that was restored, like, single implant. Like I think there was an implant bridge in the front, but it was on MUAs, which I'd never seen before, except for like full arch type of stuff. And the temp was a little off. I made her another set of temps, and it wasn't even that. It's not about being picky for me. I don't have an issue with patients being picky.
Yeah.
I have an issue with patients not being nice.
Yes. Yes.
There's a big
well
difference.
said. Yep.
Right. I beg the patients for feedback and input into the case. We have a separate appointment where we just analyze the case with them and fine tune it until they love it. And because of that, I think it lowers the stress level for everybody.
Heck yeah.
When we say, oh yeah, that's great. We have a whole appointment for that. Come on in. Tell me what you don't like. And as a dentist and a lab technician, we all have to be ready to hear it and willing to hear it and consider it part of the process instead of saying it's not part of the process.
Yep.
Like, let's plan for a collaborative approach, and then that input will come very nicely because it's expected. But if we put defenses up and we don't want to hear it, and the patient, this is the number one thing I think in cosmetic reconstructive dentistry, and I'm going to say maybe in any relationship at all, is people feeling heard.
Yeah. Well said.
Right?
Yeah.
That's important. I mean, in think about today, forget about politics or any social media. Very few people in this world feel heard. So if we want to really have patients become the raving fans that we want them to be and be happy with they have to feel heard throughout the process. And whenever we have our, hands over ears in any way, I think it's a failure.
Yeah.
Well, I think there's something to be said about being too heard. I was in an office the other day, and I kid you not, they have an in-office lab technician. They're doing an all-on-4, all-on-X or whatever. And they were telling me that the patient's coming in for their 27th try-in.
Okay.
No way. That's actually a thing? Are you kidding me?
Yeah. No,
I was blown away, and I said, why are you letting the patient be this nitpicky? I mean, at some point, you got to just say. And they said, yeah, the first one was fine. I was like, unbelievable.
Yeah, that's interesting. Often we hear in our profession, patients are crazy, patients are crazy. I always like to fight for patients and say they're very few are actually crazy.
True,
but,
yeah.
But some are. And I wonder, by the way, 27 just seems like that person's probably one of those.
That's
I
nuts.
do. I agree. Yep.
Right.
I kind of blame the office a little bit for letting them get away with it. At some point, you're allowing their expectations to go wild.
I've gone up to 3. I don't do try-ins. And by the way, that's the thing. Most dentists don't have, I hate to say it, they don't have the waxing skills if to be able to. It's usually 1 or 2 times, usually 1, every once in a while 2, and on rare occasion 3, but that's the most. But adjust it then.
Yeah.
Like adjust the tooth position, adjust the erasures. Oh, what are you looking for? And I leave a 30-minute process to play around. I could add and subtract to the temporaries or to an all-on-X try-in. If I did a denture try-in and I didn't like something, not that I do dentures, but if I did, I'd go ahead and change the incisal edge position right there. on the whether I do it with composite or move the teeth, however I want to do it, and then send it back and say this is what we want. And it's simple.
I was going to say, as soon as you said dentures, I said to myself, there's no way he does dentures. No way.
One every 3 years.
Yep.
Yeah.
That's appropriate.
Is that just because of Aspen in the area?
Yeah, it's this different socioeconomic.
Sure.
I'm taking 8s to 10s versus taking like 2s to 6s, 7s, 8s, that type of thing.
Yeah, that makes sense.
Yeah, we do very little all in X even, but on occasion, I mean, I just treat and planned an arch recently, but it's very few. It's generally fully edentulous, not edentulous, or fully dentate patients.
When did you know, number one, first question, when did you realize that you wanted to teach other dentists? And then second question is, how did you create and come up with your curriculum? Because it does sound like it's something specialized just to your teaching.
Yeah, those are great questions. It was a good buddy, Dave Sherberg, who wanted his veneers done, Florida dentist, St. Pete, Florida. And he said, Andrew, can you do my teeth? I said, sure. He said, can you teach me how to do it at the same time? Why don't we just grab a bunch of our friends and have, I don't know, 6 or 8 of us come for the 2 weekends and we'll have a blast. I'll have a new smile and everybody will learn how to do it. And I said, okay, sure. And then before you knew it, there were people signing up and paying me for this. And I had to write a curriculum. So one of my guiding principles is begin with the end in mind. As we all know, Stephen Covey. And I did that. I said, well, how am I going to teach them this? And I said, well, I have to have a lecture on this, a lecture on this. I'm going to do a hands-on component. In other words, people are going to get the lecture for the theory. They're going to do over-the-shoulder component that they're watching me do a case so they understand the prep. I mean, you could put slides up of preps all day long, but people want to see you prep 10 teeth.
Yeah.
They want to see how that flows and how that goes. I want to see you temporize it. Forget it. Slides are silly. I mean, lectures are fine, but you know what I'm saying.
Yeah.
Just like why I, wanted to see ceramists building things at the show. To me, you learn a lot about how hands move and just, I don't know, there's something about seeing it. I learned to ski by skiing behind somebody, not by a lecture.
Yeah.
So I did an outline and I said, okay, great. I'm going to teach them all of these ideas, but there's a lot of ideas to teach somebody when you're teaching aesthetics and occlusion, right?
Right.
The ideals of smile, that's great. Then the ideals of occlusion, that's great. And I'm very simple. I don't try to get too complex. To me, it's centric relation, cusp fossa, canine guidance. We're done, right? Do we need, a 2-year continuum on occlusion to teach that? Sometimes it seems like that's how they teach. But I'm a simplifier, and these are the basics, and these are the things that'll work. And so we did that, but then I still realized that there's so many competing things. You know it. I want to lengthen teeth, but then we have too steep of a bite. So how do we balance all of that? So one day on a plane flight, I don't know about you guys, but I do my best, like thinking and
no distractions.
Yeah.
No, seriously, I can't get online. I do. I get a lot done on planes.
Exactly. And I pulled up an Excel spreadsheet and wrote a mathematical formula for the perfect smile and bite. And the thing is, the inputs into it didn't exist. In other words, the measurements didn't exist. So I had to create the measurements. And I did that on a 2-hour flight. I came out and it hasn't really changed at all since.
Explain to me math for
measurements.
I mean, is it like if the length of the tooth is this, then the other teeth need to be this long too? I mean, how does this work?
It's interesting. I'll tell you what it spits out. It doesn't spit out the things It doesn't spit out tooth shape. It doesn't spit out embrasure form. Those type of details.
Yeah.
What it spits out is, where do I have to put the tooth? In other words, do I have to build it out? And think about the anterior teeth. Do I have to lengthen them? Do I have to bring them out at all? Do I have to change so it gives you length and AP changes to the tooth. In other words, the incisal ledge needs to come out 2 millimeters. Something as simple as that.
But what numbers are you putting in? I mean, the length of their nose, I mean,
it's some of them, like length of the incisor, but then display at rest, display at full smile, gingival display, how far from the wet dry line, They're incisal
Interesting.
edges.
So what we
right?
usually do just visually?
This is what you do, right? People do it visually, but when you're waxing it in the lab, you don't have the visuals in front of you,
Oh, of
right?
course, no, not at all.
Would it be
No.
nice to say the incisal edge needs to come out 2 millimeters for the tooth to be vertical and to the wet dry line? So it solves for ideal tooth position as if you're setting up a denture tooth. And then at the end of all that, it also gets the, when I say it tells you about occlusion, it doesn't tell you cus fossa. These are things you have to know, just like you have to know embrasures and tooth form for aesthetics. But for the occlusal part, it tells you, by the way, it also tells you if you should change the lower incisal edge position, right? In other words, lengthen it or shorten it. And then lastly, the last thing we solve for is vertical dimension. How much do we have to increase or not vertical dimension to have a good amount of guidance, but not too steep, not too shallow.
Yeah.
How can you change the length of a tooth before you find out if you need to open them up?
Well, I start with aesthetics always.
Interesting.
Right? I know a lot of people want to start with function, but if you start with function, then you sort of end with function. I mean,
True.
You can't,
Yeah.
right? If you start with aesthetics and plan the aesthetic incisal edge position ideally first, then you could back in the occlusion aspects of it. Let's make a pretty smile and let's see what we have to do to get the occlusion right after that.
That does sort of kind of sound like a denture setup.
It does.
Because you always do 8 and 9 first, and you put them in the proper area, and then you build everything around that.
Absolutely.
Wow.
And if you think about it, everything we need to know about aesthetics, we learned in denture class.
Pretty much. Wow.
Yeah, so it's a really interesting idea, and it gives the lab really good guidance, and we get very close to the ideal with our first set of temporaries, and we don't do a second set, we just adjust them. We adjust the occlusion, we adjust, contours, we adjust length. Somebody might say, oh, they're a little too long for me. Okay.
Oh,
No
my
names.
God.
A little bit.
No
Yeah.
names.
And some people want to go over every little line angle, and that's fine too. But you need a dentist, and I wonder about that dentist at 27 tridents. Dentists have the skills needed to make adjustments to it.
Wow.
Or it sounds like if the patient didn't like it, he'd say, okay, I'll send it back.
No, in-house lab, and they were printing every single one in office.
Wow.
It's a lot of resin.
Yeah. Which, reminds me, how often is it that people are so wanting to do things digitally that they won't do the thing that takes 10 seconds to do in the analog world?
It's either that or the complete opposite, where they try to do it on the computer and say, oh, I'll just do it after it mills or whatever.
Right. That's true, because they don't know ExoCAD really well. You're right.
It's either one or the other.
I took an ExoCAD course. That's a complicated software, if you ask me. I know it gets easier with time, but I think a lot of people don't get what they want out of the software. And you're right, do it. I think it's easy if you're going to build up a unit afterwards. But if you expect to do a minimal cutback or even no cutbacks type of situation, I think it's a lot harder. Less so on all on X, because there's not the complexities of fitting it to the prep and the gingiva that are there.
Yeah. So this mathematical, I love this idea. I mean, you must have done it 1,000 times and it works almost every time. Is there ever a time it doesn't?
Not very rarely. And even if it doesn't, it's telling you something. Is that a weird thing to say?
No, not at
really.
all.
Yeah.
And it's very interesting. The shocking thing about it for me, even to this day, is I wrote it once and didn't have to edit it.
So it's the exact same way,
crazy.
and it works right every time, and you just keep replicating and duplicating the same process over and over and over and over, and then you teach it to young docs, and they're able to do the same thing.
Yes, but you said young docs. On occasion, I get to teach an old doc a new trick.
Oh, I bet they love that.
They do. It's kind of funny. I had somebody had taught by Larry Rosenthal, which I was trained under too, many, many years ago. He took my course, and he was really, it was about the algorithm for him. He knew he wanted to learn this algorithm. And when he took the course, in between the two, he saw a lot of patients, and he came back. And I always ask everybody, what changed in your practice in the last month since I saw you? Like what cases have you done differently, or what, even conversations?
That's a great question. Yeah.
Right. I'm always interested.
Yep.
And there's always one person at the course that says nothing.
Yeah.
Oh. And then you're like, you're out of here. No, I'm just kidding.
I'm here for the CE credit.
I just wasted a lot of money. And
I wanted to come to Aspen.
Yep.
Right. But there's personality types that don't implement fast. So I thought that was very interesting, and I thought about it. It's not my fault, but I wrote a bunch of how to get the most ROI out of your CE. I wrote a series about that because having seen so many people, and most people are in a group, if they teach with 50, 60, 70 people. I teach only 10 at a time.
Yeah.
So I really get to know and care about each one and make sure they're learning. But there's personality types that don't necessarily, they're not very good at implementing even things they know.
Yeah.
And I'm right in the middle. So I get both sides.
When the doctors come to the courses, do they ever bring assistants or anything?
No, because there's so much over the shoulder. I mean, when I say no, once in a while, they can come to the lectures, but over the shoulder is in a large operatory, and we fill it with dentists. If I had a bigger operatory, I'd fill it with more dentists.
Yeah, true.
Yeah, and I could stream it to all the TVs in the office and have people sitting elsewhere, but that's just not the kind of course I want. I want a very intimate course.
Yeah.
I was talking about the dentist, one of the dentists, when he came back.
Oh, they gave you the feedback. Yeah.
Yeah. He said, Andrew, the only problem is every case I went to put in, because a very accomplished cosmetic dentist in his own right, he said, every case that I went to put in, I had to send back to the lab for them to remake it because I realized how wrong I'd been doing things for so many years.
Oh. I'm sure that made the lab happy.
Yeah, I'm sure he paid them. He's one of the good guys. I know sometimes people, sometimes the techs don't love us dentists, but I think there's good dentists that understand how much effort and how hard it is to do what you guys do. And then there's others that take it for granted and just,
Yeah.
I get it. I've seen them both.
But you must love them. You buy them houses. I mean, come on.
But I don't understand. What did he mean by that? So he sent it back for a remake because he did it wrong and now he knows how to do it correctly so that doesn't happen anymore?
Yeah, so what he was putting in a case and maybe realized that the incisal edge position was way off. He's not blaming his lab, so I'm sure he knows it was his mistake.
Yep.
And how he planned it. So I'm sure he not very generously, just did the right thing, which is pay the lab to remake it, which says something that his ethics, that if he knows better, he'll do better. Mm-hmm. And I just think that's amazing. And that, somebody might say, okay, I'll get it better on the next case, right? He said, no, I'm going to redo these cases. And I think says a lot about him as a person. I really have a lot of respect for him.
Agree.
Did he just do the math wrong? Is that what, forgot to carry the one or?
No, this was, he started these cases before he took the course.
Oh.
Right. So then he saw the algorithm and he believed it. Oh, that's the other thing that I think it's a testament to, besides his character, but also the algorithms, convincingness once you know it and understand it.
So is it like a software? Obviously it's a lecture, but when you talk about the algorithms, do you actually input it? The dentist inputs it and it figures it out for them in conjunction?
I put on an Excel spreadsheet. It's very doable, but as a software, I mean, I can make an app for it, but
I was going to say, where's the app?
It's an easy app, but there's also, it's as simple as filling out the measurement form that we give. You fill out the top with the measurements. At the bottom, you go from left to right and, do the math. It's not that complex. The greatest ideas in life are simple. And this is my greatest idea in life, is a simple formula that figures out very competing things, right? Incisal edge position, how do you start with that and then go to function? But it's very easy. It goes in the right order and everything is ordered correctly on the sheet. What is this? And our newest version actually tells you, take this and do this, tells you the math instead of having to remember it or going back to the lecture. I do it, because I know how to do the math.
Right.
It tells you,
Have you ever thought about teaching this to labs so we can talk to our doctors about getting the information for more success?
Yeah, but then the docs don't know it yet. They have to take my course. I think about I don't want to say, what's the term? We're called Cosmetic Confidence Coaching, CCC approved labs that understand it. I've had lab techs come and take our course just for fun. I don't know. I tend not to charge lab techs. I tend not to. I've never charged a lab tech. It's usually a lab tech I know and I like online, and I say, come on down, hang out. For some reason, I always find room for a lab tech. I won't find rooms for assistants. I won't find room for the course is sold out. You can't pay me to get into it, but I find room for a lab tech because what the lab tech knows, that they'll stand outside the room They don't need to learn the prepping as much but if there's room, they'll pop in.
Sure.
I think of somebody, the last person who came and he's like, Andrew, can I look at your preps too? I'm like, come on in. But if he was sitting in that room the whole time, we know the capacity is 10 people.
Yeah.
By 11, it's getting a little tight. So I think they're understanding that they're guests, but we treat them as every other one. They eat our meals with us. They come out to dinners with us, and it's always fun. We like, I don't know. I have a thing for lab techs, is the truth.
Well, that's why you're on the podcast.
Yes.
Yeah.
Well, Elvis, he asked about how you train them, and I was thinking about how brilliant it is that you're expanding your laboratory so that your dentists can utilize your lab techs that already understand what you're teaching.
Think about how long it takes to learn something. Sometimes it's repetitive, like feedback, right? When you train one of your lab techs in your office and you have a thing that your style, we all have styles one way or the other. And it's sometimes it takes repetitiveness. So I'm sure I could teach lab techs, but I think my dentists are going to get the best result if I'm still overseeing the crew.
Agree. Damn.
Yeah.
So have you hired more technicians, or?
We have somebody starting in 2 weeks. I have quite we've got a lot of applicants, but it's hard to find the talent I'm looking for. And people don't have to be like the most amazing artisan technicians. I to be honest, we're very simple with our build-up techniques, and they're not complex, but they need good eyes for line angles and things like that. They need to be good players. There's a lot of things they need, but it's hard to find the people I'm looking for. What I'm really looking for, my dream is that the same person, and this is so rare to find these talents, designs the case and does the porcelain.
Yeah, you know what? That is rare. You're right.
Yeah. But some of the best labs in the world, that's the case. And the reason that is because, and I know you've seen it, I think you even alluded to it a little bit ago, is, why is the design not perfect? And now I have to do all this work in the
after the fact. Yeah.
Right. And they're not giving each other what they need. There's something about, if you're doing both parts, you're going to give yourself what you need.
Mm-hmm. Yeah.
Right.
True that.
Make the contact spot on, so you don't have to spend as much time grinding them. You're going to make the shape a little better, as good as you can make it on ExoCAD before you go and mill. And this way there's less work. Physical world. How
did you choose ExoCAD versus some other softwares?
We have 3Shape too, if somebody's a 3Shape person. But the technicians, I try to let my technicians choose things like that for sure. Yeah. I mean, there's enough. I'm trying to get them into a certain philosophy, a certain, unworn tooth form, straight teeth. When I say straight, I don't mean like not natural, but in other words, my goal for my patients, and my patients' goals, I know they are teeth that look like they already had orthodontics, not that they didn't have orthodontics.
Yeah. Yep.
And people, especially European ceramists, will criticize me for that, or criticize me for doing bleach shades, or, believe me, they'll criticize me for anything. You know how it can be.
Oh yeah, for sure.
Some people just look, right?
Yep.
And this is my argument to all of those. If they could go get Invisalign and a whitening and get straight BL3 teeth, then when they're spending the kind of money they're spending with me, they deserve that at least. Or if a box of white strips will get them to a BL3 for $50, when they're spending $50,000 or whatever they're spending, it's the least I could give them is the shade that they want. Do I want the depth and translucency of a natural, when I say natural, enamel BL3? Of course I do. I want all of that. But the idea that, I know I have a good friend who's an All-in-X buddy, and he says he will never do below a B1. It's a travesty and da-da-da. And he's like, you could do it on veneers, but I can't do it on All-in-X. And I think that's a little silly personally.
Yeah, whatever they want.
Yeah. And if you're not getting the life-like look out of your zirconia and staining or layering technique, then maybe work on that instead of saying they can't have it. Because I've seen, we did a BL1 case that looked gorgeous. Yeah. And that's not what I like to do. I like to be more in the BL3 range, or I'm B1 myself. I mean, B1 Emax, which is probably a hair lighter in reality. When you mill those, they're not quite true. And people love my smile, and then they choose the BL3. It's fine.
I want it a little bit brighter, Doc.
Yeah, exactly.
Who did your work?
My mentor, Jeff McClendon.
Aw,
Nice.
Yeah, my
that's
mentor. I
great.
flew in, and our lab did it, of course, but
Of
he
course.
prepped my teeth and adjusted my occlusion and all that good stuff. And I tell you, if people say occlusion doesn't matter, it's the biggest bull I've ever heard.
Yeah.
My neck discomfort of dentistry went away as soon as my occlusion was adjusted.
So the pain you get from bending over and looking down went away
Yeah.
because of your occlusion?
Yes, immediately. My neck has not hurt in a year or what has it been a year and
Interesting.
let's see. Wait, yeah, wasn't this just yeah, it's been a year and a few months.
Is that because you're not biting down? And I just don't understand how that works.
Yeah, it's amazing. It's the body's very connected, right? We all know the
Sure,
song. I don't
yeah.
have to sing it for you. When the posture of the jaw and the TMJ helps predicate the posture of the head on C1 and occip. So it changes the entire posture of your neck right there. It was
Interesting.
instant. It was shocking.
Is that part of the formula?
Well, CR is just where we're working from. So it's not in, it doesn't need to be math. It's one of those things, just like cusp fossa doesn't have to be there. To me, occlusion is, like I said, it's CR, canine guidance, and cusp fossa. I don't try not to get too much more complicated than that because, and my mentor will, he gets into I don't want to say the weeds because I don't think they're weeds at all, but I think it's that simple and I'm so dumb. I have to keep it simple. And
Yeah.
the good thing is my students appreciate that because I have all the dumb people come to me to learn and I get them, just enough information to not be dangerous, but actually get great results. We've got great success over the years.
So you say you have like about 10 students. So you have one patient and it's your patient, and then you go through the whole protocol as they are watching you, just the one patient. A lot of the live patients, each dentist brings a patient, but it sounds to me like it's your patient, yourself, and then the students.
Exactly. And that's the over the shoulder part you're discussing where I'm treating the patient. Then there's lecture components to go over all the theories and everything that we usually do the
Mm-hmm.
lecture first, and then they get to see me do it on the patient. And then there's also hands-on. In other words, there's exercises that they're doing. They're learning to take the records, the measurements,
Mm-hmm.
central
Mm-hmm.
correlation, all of those things so that, and then they work up each other's cases on their articulator in between. So there's a lot of components and
Oh, I love that.
right.
That's cool.
I think dentists should wax more themselves, not to take away work from you guys, because it's called a diagnostic wax up. And I think the dentist should diagnose the case, the occlusion.
I think that makes a lot of sense. I mean,
I do too.
Right?
we're just making it ideal to what
Yes,
we think is
exactly.
ideal.
And what I also urge them to do, they learn so much about occlusion by waxing a case. They also learn how to adjust things in the mouth if they have to. If you can't do it in wax, or when I say wax, sometimes most of my students and even myself, oftentimes we're waxing composite. It's just a material we're more familiar with.
Mm-hmm.
Mm-hmm.
Neither here nor there, but especially if they're using flowable composites to wax the case, then when they go into the mouth to adjust the temporaries and say, oh, I want to adjust this line angle, they can add and wax in the mouth as well.
That's pretty brilliant.
How often
love
do you
it.
do these classes?
Yeah.
We do them just twice a year, once in the spring and once in the fall.
Yeah, because you're shutting down for 4 days, right?
Yeah, it's a Thursday and a Friday, so we really only take one day out of the week.
Mm-hmm.
But we do it in those times because that's when Aspen's slower. I have a little more time in my schedule. I'm not swamped with big cases as much.
Yeah.
And
Yeah.
I find it a perfect time to do that instead. And it's just wonderful.
And then they come back, right? So then you get everything ready, and then they come back, what, in like 3 weeks to see you see them?
We usually wait a month, so that's 2 days, and then a month later, 2 days.
Wow.
Yeah. And that's perfect because our process is prep and then have them back. I usually like to have them back to adjust their temporaries 3 to 5 days later, but for the course, we'll do it the next day for convenience of the students.
Mm-hmm.
And then at insert, it's insert and a post-op to fine-tune the bite and maybe find some extra cement that you left behind, things like that. So they get to see all of that and so much more, really.
Wow.
It's really a great course.
So you're doing these out of Emacs?
Yes, I'm 100% Emacs guy. I know Zirconia
Yeah.
is the way everybody's going, but I just love my Emacs.
Mm-hmm. Are
Yeah.
you pressing or milling or?
We do both. We have both setups, and depending on the situation, but we're trying to move more to milling. we're working on that. That's why I was at lab day looking for the ideal Emax mill. I think a lot of anything could mill zirconia. I don't want to say anything, but a lot of mills could mill zirconia. Emax is just so much more temperamental.
Yeah. Well, I know what Barb recommends.
I know. I was going to ask you. So, in the ingot selection, does your ceramist come in and recommend like is a MT or an LT or a high translucency, or do you mostly use the medium translucency ingots, or do you are you all over the place?
I'm a systematic, boring guy. I like to do things the
Yeah,
same way
thought
every
so.
day. You thought so. So I'm MT all day long. Give me Emax,
Yeah, me too.
right?
Yep. Yep.
HT, we know HT's issues, right? It's so low value
Yep.
and gets
Big
lower
time.
over time. And LT, you
Yeah.
might as well do a PFM.
Bingo. Yeah.
Mhm.
We use all MTs. Occasionally I do a HT, but not very often. And I never do a full mouth case out of it. Maybe it's like a single central or a lateral. But yeah, I'm definitely an Emax fan. You mentioned kite. Are you using Mio?
We use Mio as our surface, but we micro layer.
Yep.
It's not, it's a very real simple micro layering situation. And what we've done is, again, we're doing mostly these big cases. We might change everything when we're doing a single unit, like you mentioned, but we do a lot of 10 and 20 unit cases. So
Yeah.
we've created our own shade guides out of our Emax, layered the way we layer so that we can be pretty accurate with what shade we're going to. The shade guides that people use are they're silly. They have no
Yeah.
semblance to reality. So how easy is it to have a patient choose from our custom shade guide made out of the materials that we use every day?
Yeah, which is pretty darn smart because they don't change. If you know and it's an MTBL3,
Mm-hmm.
it's the same thing that you're going to be milling it out of. So that's pretty awesome.
Yeah. Consistency. That's my big thing.
Yep.
PPPP.
Yep. No surprises.
Yeah. So wait, I think you'll like this. PPPP, precision process for predictability and profit.
Love it.
Right? Every time we redo something, we're losing money.
Oh, 100%.
In my world and your world, right? You don't want
Yeah.
everything to spin back. That's why I'm sure you charge extra for the single central. That's why I charge extra, because I know I'm going to be redoing it.
You're going to be doing it 3 or 4 times. Oh, hate those.
Even when the lab guy's in the same building, you still do it 3 or 4 times.
Exactly. Yeah.
That's
I
nuts
went
to
from
me.
charging in New York City when I didn't have a lab tech in the office. I used to charge double for a single central, and now I charge 1.5 times.
Yeah. Good call.
Yeah, because a little bit easier. Usually we can custom stain it and get it going right there. At least it's only a little extra chair time versus redoing it because of the wrong ingot. Again, we took a shade tab picture with our MT shade guide, not their shade guide. Their shade guide's kind of, it's not layered at all. It's not glazed at all. And it's something about using those tabs that really help us get closer quicker.
Yeah, regular shade guides look like denture teeth.
Yeah. No reality. And would you guys press or mill?
Very, I mean, a minimal prep. We'll press something that just has sometimes when the doctors do veneers and they cut it all the way to the lingual and it's impossible to mill out, we'll press those. But I try not to if I can avoid it. We do have 2 PM7s.
Oh.
And they're amazing. You can pretty much get anything to mill. But occasionally I'm just not a fan of cutting down the freaking pressed units, and it's just kind of a nightmare, and it takes a lot longer. But yeah, so a little bit of both.
Oh, cool.
Mostly
milling.
Yeah.
And the PM7, I know it's amazing, and I've been eyeing it. I hear it's very picky with its air, right? It has to have perfect air at all times, or else it'll not be happy.
Yeah.
But if you maintain it well and give it the air it wants, I hear it mills amazingly.
It's literally, my technicians take really good care of those mills, and they make sure that they change the stuff that they're supposed to change and that they've got good burrs. And yeah, our air pressure is pretty regular here in my lab, but I recommend them highly. They're unbelievable.
Awesome.
Love them.
Okay.
Yeah. I know they're expensive, but sometimes you gotta bite that bullet if you want that predictability and the profit. I love the peas, but yeah, so I recommend it.
Awesome.
Just don't ask her about the oven that she uses.
Oh yeah, I know. I do have a very old oven.
Oh, that's
all. The mills are good.
You know what? You have the old oven because it works and you like it.
Yes. Thank you.
Right? It works. Yeah. If it didn't work, you wouldn't be using it. I'm pretty confident of that.
Bingo. Yep. And Elvis had to bring that up.
I had
to.
Teasing her. Nice.
Well, Dr. Turchin, I think that's some pretty amazing stuff you're doing in Aspen. I had no idea you're teaching so many other dentists
Oh, it's fun.
this
I
unique
love it.
way. Yeah.
How do they find you? Twice a year? How do they find you? Do you have a website? Obviously.
Yeah, Cosmetic Confidence Coaching. Where is
Nice.
it? Yeah, right. Cosmetic Confidence Coaching. Yeah, no, I think it's cosmetic. I don't know. What's my website? Oh my god, 'cause I don't think it was too much. Let's see.
We're
It'll
leaving
come.
this
We can
in.
edit that out.
No, we're leaving
Edit.
it in. That's
Edit.
funny.
What's my website? Cosmeticcoaching.com. Yeah.
Cosmeticcoaching.com. Right on.
Yeah.
Love it.
And they find us there. And I teach in different organizations, so they hear about my course and things like that. From Dental Clinical
Word of
Pearls,
mouth.
Dental Success Network to Practice on Fire. I'm kind of all their cosmetic educators online. So they like my posts, they like my work. They say, I got to try this Turchin course.
I love it.
90% of the time they love it. 10% they do nothing different at back of the office.
Yep. Hopefully it's a little less than that. It sounds amazing.
Before we
Awesome.
sign off, I want
Yeah.
to know if there's somebody listening out there that is really good at exocad and really good at ceramics and wants to live in Aspen. Are you looking?
Yes. Always looking for great talent.
It sounds like an amazing experience for someone that's got those skills.
Yeah. Especially for somebody that loves, I always think they have to love to ski or bike or do one of those outdoors things too. Not that it's, some of the best fly fishing in the world and all of that stuff.
Oh,
Um,
yeah.
Not that it has to be, but Aspen's a place. That's what Aspen's about. And for somebody to pick up and move across the country and come to Aspen, I think it's best when they like those things as well, or want to try them.
I'm agreeing with you 100%. I might just be that girl.
Yeah. Are you a skier? Are you a skier?
Hell yeah, I'm a skier.
Oh,
I'm
nice.
a skier and fisherman, ceramist, but I don't know exocad. But I'm going to learn it.
There you go.
We have
That
3
day's
shifts too.
coming.
Let's not forget, we have 3 shifts. I don't
Give her
wanna-
a few months.
Oh, yeah.
right.
Yeah. That's right.
But that's my dream person. If it's just a pure digital person, right now we have, I'd say we have to steer towards that because our team now is kind of more analog right now, and I need a little digital talent for sure. Although I have an amazing designer in Greece that I use. Don't tell anybody, but I just I loved his work, and he's just been amazing to work with. It took some time to learn my style, but what I love about him, he's one of those people that are really good at making libraries. I hired him to make our libraries, and he made us custom libraries based on our favorite natural teeth in the practice.
I love that.
Yeah,
Yep.
so helpful. And
Yes, big time.
we're starting with something real instead of trying to create real,
Awesome. Dr. Turchin, thank you
Thank
so
you.
much, man.
Thank you. Thanks for having me, and it was a real pleasure.
Yeah,
Yeah,
thank you
that
so
was
much.
great.
And
Good luck to
next
you.
lab day, stop us. Say hi.
Awesome. Take care, guys.
We'll talk to you later.
Thank you. A big thanks to Dr. Turchin for coming on our podcast and sharing your story and your philosophy, which is pretty amazing. We, Elvis and I, and our whole industry are big fans of in-office technicians, and it sounds like you have an amazing opportunity for somebody to really grow their skill set and also help out a lot of people. Maybe you even know a doctor that could use his help when planning cases. And if so, send them to cosmeticcoaching.com, and maybe they will finally give you what you need, meaning more and better skills to treat, which I love.
We can only do as good as what we get.
You know it. So true.
All right, everybody. That's all we got for you. Barb, go do your grandmother duties.
I will. Thank you.
Talk to you next week.
Have a great week, guys.
Bye. How's the baby?
He's good. He's so cute.
The views and opinions expressed on the Voices from the Bench podcast are those of the guest and do not necessarily reflect the official policy or position of the host or Voices from the Bench, LLC.